The hospital report card, a much talked about effort to provide transparency about quality information, is beginning to emerge as an important tool for consumers, just as President Barack Obama and Congress prepare to initiate healthcare reforms demanding such information. You're listening to ReachMD Radio on XM 160, the channel for medical professionals. I'm Bruce Japsen, the healthcare reporter with the Chicago Tribune, and joining me today is Bruce Crowther. Mr. Crowther is the president and chief executive officer of Northwest Community Hospital in Arlington Heights, where he has been the suburban Chicago hospital's top executive since January of 1992. He has more than 30 years of hospital administration experience, including executive stints at Elmhurst Memorial Hospital and administrative positions at Northwestern Memorial Hospital in downtown Chicago. He joins us today from his offices in the Northwest Chicago suburb of Arlington Heights. Bruce Crowther, welcome to ReachMD Radio on XM 160, the channel for medical professionals.
Well, thank you, Bruce. It's a pleasure to be with you.
Well, I've known you and your system for years, but our audience at ReachMD is national and in some cases international. So many medical care providers today and consumers are listening to our program, and they know the hospital report card idea is something that they've heard about, but generally they don't know just how much it's been implemented. And if you could tell us a little bit about at Northwest Community, where you're somewhat ahead of the curve on this for the state of Illinois and the country.
Well, I'd be happy to. This goes back a few years. A few years ago, we had an interesting discussion with our board and recognized that our consumers and our patients were becoming increasingly educated, increasingly informed, and did not easily have information about us. So they were hungry for information, and it wasn't there. And we said, as a field, we've been so protective about our data and our results. While we've used it internally to improve quality, we've really not shared it outside, and we need to do that. And so we made a commitment to become the first in the Chicago area to do this and basically start publishing the key quality and service indicators that we had been measuring for some time and make it available on our website to the public. We studied a number of other systems around the country that had done this, so we're not the first in the country, and learned from their mistakes, which allowed us to move along a little more quickly in its development than perhaps some others. But we began publishing this data in September of 2007 and have continued to add to the database ever since.
Well, tell me a little bit about, and for our physician audience, consumers that are tuning in, what can someone find if they call up Northwest Community Hospital report card?
Well, if they go into our website, it's pretty easy to find a section called the Quality Report Card. And what we've developed is a kind of a color-coded system by category that compares us to national and state averages. And we're either above the average, or better than the average, which is colored in green. Now, the actual percentage numbers are there so that you can see it quickly. We are at the average, which is yellow, or we're below the average, and we're working on improving, which is red. And the categories are clinical quality, infection control, mortality, our nursing care, and the way patients rate that, patient safety, and patient satisfaction. So we've got a variety of measures within each of those categories that patients can go in and see how we're doing.
And some things, for the folks out there that are like, oh boy, we don't want to be first, because if you're first and you post something on there that doesn't make you look so good, your competitor may use it. Tell the folks out there, the consumers, patients, even fellow hospital folks, how did this come about? And were there some things that you worried about and also that you benefited from by publishing some of this data?
That is a great question, and it is right on target. When I brought this up as a recommendation to our board, they immediately moved to, Bruce, everybody doesn't measure these things the same way. And so should we not be concerned about what I call the first liar never wins syndrome? Meaning we come out with our data and our competitors immediately come out and start advertising around things they do better or so on. And I said, and this was our eventual conclusion, we can invent reasons not to do this forever. And the only one that really suffers is the community and the people that are trying to get some information on where to go for their care. Let's rise above that and be the leader here in this. So we get to the second of the two reasons that we wanted to do this. The first clearly was to give patients information. But the second reason was to be the first so that or take the plunge, so to speak, so that we stimulate other hospitals thinking around this and perhaps move a few of them to start doing the same thing. And in fact, that has begun to happen. And in Illinois, the Illinois Hospital Association, had a series of meetings and has decided that across the board, let's create a database that reports this data for all hospitals. This really gets to one of the weaknesses in one hospital doing this. You can go into nch.org in our website and click on the quality report card and find the data for Northwest Community Hospital, and it will be compared to just national averages and state averages. But that's probably not what you really want. You want to go on and compare it to the other hospital or the two other hospitals in your market area that you're considering. And we're not able to do that. And so I'm really quite excited that there will be a statewide database where you can put 2 or 3 hospitals up side by side and compare to each other. And then you begin to have meaningful decision-making types of information.
And with that coming, and we hear a lot about that, whether there is health care reform or not, I think many people think that something is going to pass. But that's what the president's talking about, really. I mean, people have always said, oh, well, we have to have competition and free market. But there really hasn't been that without this kind of data, has there?
No. There's not at all. I think there are a couple of barriers to it. One is the unavailability of easily accessed comparative data. And even when you can compare, we still have the problem of it not always having been calculated the same way. And the other has to do with the payment system. When you introduce a third-party payer, an insurance company that's basically paying your bill, your sense of accountability begins to diminish, and you're much less, I guess, interested or inclined or motivated to really spend this money wisely as if it were your own dollar. And I see some of the form of some of the insurance plans changing, regardless of what's going on in Washington, to try to make more of the dollar that you're spending, the insurance dollar, take on some of the characteristics of your own money. And so some of these accountable health plans or consumer-driven plans are designed to have consumers behaving as if this is their own dollar that they're spending. And I think you need both of them to really get true consumerism, which will go, now the market can work once you have consumerism, and I think that we would begin seeing a lot of improvements happening on their own.
Well, if you're just joining us, or even if you're new to our channel, you're listening to ReachMD Radio on XM 160, the channel for medical professionals. I'm Bruce Japsen, the healthcare reporter with the Chicago Tribune. I'm your host. And joining me today is a fellow Chicagoan, Bruce Crowther, who's the president and chief executive officer of Northwest Community Hospital in the northwest Chicago suburb of Arlington Heights. And we're talking about hospital report cards, and it's an idea that's been bandied about in various forms for years. But Northwest Community is among the few, unfortunately, hospitals that post data, quality data, online on its website, nch.org, and this is now expected to become a standard with healthcare reform that the president is talking about. And Bruce, if you could tell our listeners, are the number of consumers going to your website, is it on the rise? And if so, what are they telling you about this information?
Well, first, the number is on the rise, and we have tracked that. Interestingly, the early feedback that we received, and it's been pretty consistent, applauded us for having the courage to go public with our data and was not as concerned about which areas were red and which were green. They have noticed that when something comes out as red, meaning it's below the national or state average, we give a lot of emphasis to that and move it to meet the benchmark. And so we've gotten appreciative feedback since then. But I would say the overwhelming tenor of the feedback that we received and have received has been around just thank you for giving us something to follow and be able to measure about Northwest.
And where do you see this headed? I mean, do you see one day Northwest advertising prices online? What have you learned from this? Bad, good, the otherwise?
Even though we already collect the data, it's a fair amount of work to maintain this and keep it populated, and yet we think that it's worth it. I believe that, just based on patient feedback, that there's more to be done to make this completely relevant. There are really two aspects. If you think of yourself contemplating going to a hospital and receiving care, there are a few categories of information you want. We're really only providing one of them, and that is the hospital good at this? And so we can give you data on that. But the question you might ask even before you selected a hospital would be, is my doctor very good at this? How many has he or she done of this procedure, and what are his or her outcomes? That's not something that we have out there that's made available today. I do believe over time we will get there. There is talk about making this part of the state's database because obviously that needs to be comparative as well. To look at a doctor's mortality rate on a certain procedure is really meaningless if taken only in a vacuum. And of course, I've had many discussions with doctors that are worried about this, not because they're not proud of their data, but because you've got to consider the complexity of the case, the other kinds of health issues that a particular patient had. And so it's not an easy measure to use and make comparable. But I think that we will need to get doctors' performance built into a database. And the other one is price, meaning, and I don't mean what is the price, list price, what is this going to cost me? I have a certain kind of insurance. What will I end up paying out of pocket at the end of the day? There are computer programs now that are beginning to model this and be able to make that available in a consistently accurate or increasingly consistently accurate way. But I think until you've got physicians, hospitals, and out-of-pocket costs built into this, then it's really not a fully consumer-ready model.
But wouldn't you say it's probably or definitely coming? Because when you think about it, a lot of this stuff is available out there for some computer geek or maybe even a teenager to figure out online with a Google search. But it's probably best to have it packaged in a coordinated way, which is kind of what report cards are all about.
Absolutely right, Bruce. And I don't think we're far from this at all. There are a couple of companies out there that are selling the pricing piece. They have their flaws, so they're not 100% accurate, but we're getting there. And I would say that in the next year, many of us will be putting out-of-pocket cost data on the web. There are many that are putting price out there, but price to me isn't all that meaningful when you've got another party paying a portion of the bill. So you've really got to know, what am I going to pay out of pocket? So yes, this is all coming, and it's coming fast. One of the things that I like about the discussions in Washington is that this kind of transparency and comparative information is being encouraged in the discussions they're having, and I think that'll just accelerate it. I really think this field is behind in not providing that kind of information.
Well, with that, I'd like to thank Bruce Crowther, who's been our guest. He's the President and Chief Executive Officer of Northwest Community Hospital in Arlington Heights, a northwest suburb of Chicago, which has been ahead of the curve on the hospital report card movement that you're hearing more about in the quality versus cost debate going on in Washington with healthcare reform. I'm Bruce Japsen of the Chicago Tribune. I've been your host, and you've been listening to ReachMD Radio on XM 160, the channel for medical professionals. ReachMD, online, on demand, and on the air. Please visit us at reachmd.com, and I'd like to thank you today for listening.